Thanks so much for taking the time to view this recorded webinar. I'm Sue Kressly, the Medical Director for Office Practicum, and with me this evening is Dr. Suzanne Berman, who's the Assistant Medical Director for OP. And Suzanne's been hard at work trying to put together some resources for our Office Practicum community so that we can navigate the CARES Provider Relief Fund, which is monies provided to pediatricians, and so we can do this successfully. So we are also, I am chair of the Pediatric Payer Advocacy Advisory Committee at the Academy, and Suzanne, you are?
The chair of the section on administration and practice management at the AAP.
And so together we try to do our best to support everyone and making sure that we get paid appropriately for all the hard work we do. So Suzanne, we're talking about the CARES Provider Relief Fund, and I am going to be your MC while you walk us through the documents that you've prepared for our users. So take it away.
Great. Thank you. So I have written a 40-something page document to sort of give you an idea of what this requires out of your practice. I'll tell you right now, this is not something that's terrifically simple. It's not 3 clicks, 2 fields, and click and you get money. It's a little bit more complicated than that. So I encourage you, first of all, to read the whole document. It's not as lengthy as a biochemistry tome, but I'm sure you can get through it. I'll say that, first of all, we've tried to lay out the document sort of in order of how you'll need to use it. First, the things that you want to prepare, and then sort of step by step walking you through the process, and then some final sort of FAQ type questions at the end. We're going to start with a warning. This portal does not have a save and come back option that works reliably. It has taken me, this is actually the 4th time I'm going to sit down and attempt to put in all the data and actually finish it before I'm called away to see a patient and it times out, or I have to do something with my sons. So I encourage you to get all the data you need before you even log in to start this, and then once you sit down and do it without any interruptions. There's nothing more frustrating than trying to get through something and then you get called away and then you have to start all over again.
And if I can interrupt you, Suzanne, there is,
yes,
as you'll see here, the application, a PDF version. So we encourage you to print that out, put your data, the numbers you're going to plug in those fields.
Absolutely.
And then also there will be additional things you need to upload. You want to have them available, not in paper because you can't upload paper. So a PDF version or something that you will be able to upload when you get to that point.
Right. So let's run through that here in the next section real quick. The stuff that you're going to need. Well, no, let's talk about eligibility first. This has sort of been all over the news, but for High Points, this distribution of funds is for practices that did not get the Medicare, i.e. Seniors and disabled adults distribution. If your practice, because you're part of a multi-specialty group or you're owned by a hospital that also sees adults, or maybe you're a family practice pediatrics group, your practice probably already got money from the Medicare tranche. If you did, even if it was just, $20 or $30, you are not eligible to get money through this particular program at this time. There is an email address there. If that applies to you, that you only got a pittance through the Medicare tranche, and you would have been eligible to get a higher percentage or a higher total payment amount through the Medicaid tranche, i.e. 2% of your gross receipts. The AAP wants to hear from you. There's the email address, covid-19@aap.org.
And if I can interrupt, the mistake that people made was they felt like if they got $300, they weren't going to go through the paperwork to get 2% of that $300. It was 2% of your entire gross receipts, not just for Medicare, but your whole practice. And most people didn't know that, so they didn't apply. And so if you got a pittance from care and you did not apply for that 2% of gross receipts, please use that email. The AAP is collecting data. But that also means that this is about 2% of gross receipts for all of our payers as pediatricians. This isn't 2% of your Medicare, Medicaid, and CHIP. This again relies to 2%. That's what they're trying to make an equivalency between Medicare and Medicaid.
Right. And then the other thing that you need to be aware of is that you have to have billed Medicaid or CHIP for healthcare services at least once for one patient, one time in either calendar year 2018 or 2019. At this time, things are still a little vague about if you have only billed a managed CHIP program but not Medicaid, like you only take CHIP but not Medicaid, can you still apply? We're getting sort of mixed guidance on that, and so AAP staff have gone straight to HHS with that question, and we will certainly provide an update when we know for sure. I would say if you have billed CHIP, even if you haven't billed Medicaid, at least try to start the application process, which we'll go through that in a minute. And if it finds you, then go ahead and fill it out in good faith. You can always reject the money if you find out later that you shouldn't have applied for it. There's a process for that too. And then obviously you have to have a reference year, which is number 3 there on the top of the screen. You have to have filed income tax for this practice's TIN, and when I say TIN, I don't mean like aluminum. I mean tax identification number, employer identification number, which is basically the practices or business equivalent of your Social Security number. So if you are a new practice in 2020, you actually don't qualify. You have to have filed an income tax return for this practice in one of those 3 prior years. And
many of us didn't file our 2019 taxes yet because everything got extended because of the COVID chaos. So
yes.
there are a lot of us who are going to have to use our 2018 year.
That's right. And then obviously you have to still be working in this practice. You have to still be providing some care after in February and beyond. There is no requirement that you're a primary care doc. You can be like a pediatric developmental specialist. You might have pediatric therapists or psychologists or licensed clinical social workers in your practice. Their work and their revenue also counts for this. Again, it's by tax ID, not by provider. Now, you'll obviously, some other programs are different, like Meaningful Use was by clinician, by provider. This is by tax ID, by practice number. A couple of things you need to decide first. One person for your practice. You can't, Dr. A in your practice can't apply and Dr. B chooses not to because it's too much work. It's either all of you apply collectively as a practice or none of you do, and only one person can sort of hold the key to that kingdom. Once one person for your practice starts the registration process, that person needs to complete it. Your reference year, you have to choose the year in which you most recently filed an income tax return. You can't pick and choose which year you want to use, which you might want to do because, as you're going to see, some years might be more favorable for you depending on what you use for a reference year. You might be able to get more money using one reference year as opposed to another, but you don't have that choice. It is, as of the time you submit, the year for which the IRS has your most recent tax form, which, just like Sue said, our practice has not submitted our 2019 form, so we have to use 2018. Then here's a list of the documents you need to gather. You need to gather your practice's income tax return. This is not the doctor's individual 1040 unless the doctor is a sole proprietor, which is unusual in this day and age. You're looking for a 1065 or an 1120, depending on whether your practice is organized as a tax partnership or a professional corporation, S Corp, C Corp, and so on. You're also going to need the 941 form, which is your federal tax withholding for your employees for the first quarter of 2020. You have to upload that to substantiate the employees you have.
And that may be if you use QuickBooks and you use them to submit your information by QuickBooks Online, it might be there, but your accountant should know where that lives.
Right. And let me also take this time to say those two forms are, you're going to rely a lot on those, on your tax form and your employment records. So just sort of be forewarned, if you have not talked to your accountant, bookkeeper, CFO, whoever about this yet, you want to do that pronto.
Because you're going to want to decide what that reporting year is. Remember that, and so the first quarter of 2020 for the employee tax withholding is a non-negotiable, but the rest about your revenue is based on when you last filed your taxes. So let's move along to the FTE worksheet.
All right, so you're going to need to download this and fill it out, depending on what on who your independent non-employed clinicians are. We're going to get to that in the section. And then the gross revenue worksheet probably won't apply to most practices. You only need to download and complete that if your practice acquired or disassociated itself from other affiliated tax IDs. For example, if your practice acquired another practice which ceased operations, but you absorbed that practice during the reference year, which we said is the last year for which you to file the tax return, you're going to need to fill that out. So then finally, the data you're going to need. First of all, a list of your employees as of the end of May and their FTE equivalents. Obviously, OP can give you like login information, but we don't know how many hours a week Wanda and Bertha work. That's something that you're going to have to determine. Your accounting profit and loss report.
Before we move on to that, Suzanne, just to clarify, there will be different, I believe, tabs in that worksheet for who are your providers and who are your non-providers. Who are all we gathering this information about?
So you need it for everybody. You need it for because you have to report your FTE equivalents of clinicians, and you need to report your FTE clinicians of clinical support staff. So for example, LPNs and medical assistants who are not independently credentialed or licensed to provide care, but do assist in treating patients. And then you also need the FTE equivalents of your support staff who don't provide patient care, but are a part of your practice, like billing staff, receptionists, medical records clerks, and so on.
Cool, but they're divided into different tabs, I believe, on that spreadsheet that you're downloading and uploading. So you can play with that to see what it looks like, but be prepared to answer all that question. And you don't have to do that at the same time you enter your information on the portal. You can fill that out in advance and just be ready to upload it.
Exactly. You want to look at your profit and loss report to see what kinds of income you had. Now, most income that medical practices get is related to patient care. That's why we're in business. But you might also have some non-trivial revenue from things like rental income if you have extra space in your practice that you're renting out to an unrelated party. You might have revenue for teaching medical students or residents, or for doing research or consulting. You might have gotten meaningful use money for things that are other than I provided patient care. So you're going to need to subtract that out. The best way to find that is not actually in OP. Again, it's in your accounting, which is your QuickBooks or Peachtree or whatever your accountant uses. Summary of receipts by payer type, that's the OP report. We're going to get into that. Then you're also going to need to do a little bit of homework in terms of how were March and April for you in terms of increased spending, in terms of how did you, what expenses did you have that you wouldn't have had if COVID hadn't happened? And that might be payroll and it might be supplies. You're also going to want to compare your receipts for previous Marches and Aprils, which you can do in OP, but you can also do in your accounting software. And then you'll need, again, just the sum of any SBA, Small Business Association money you have received. That might include things like the PPP Paycheck Protection Program money, if you've gotten any, the EIDL loan, EIDL, or if you didn't get the full loan, but you applied for and received that sort of free grant money, which was $1,000 to $10,000, depending on how many employees you have. You need to find out what those sums are. And then also, this is rare, but if you did get FEMA money from the feds, you have to report that too.
And if you got FEMA money, you know you got FEMA money, so don't go looking for it if you don't know what it means.
That's right. Whenever I do these kind of talks, there's always someone who is unfamiliar with using Excel or Google Sheets, which does essentially the same thing. I've provided some links, so you don't have to do all the computations by hand. I'm not going to go through those. You can do that over a cup of coffee. So diving into the portal, the first thing you have to do is prove that obviously you have the right to submit data and receive money on behalf of your practice, because you don't want just anybody monkeying with your money. You need to get an Optum ID. Most practices who take United Healthcare already have that. If you don't, you need to follow the instructions that we've listed.
Yes, this is the same Optum that owns United Healthcare, who owns everything, but they already had a system to be able to report and distribute money, which is why the government chose to partner with them as a way to distribute and get this information out.
Right. These folks have already used this method to distribute the Medicare $50 billion of money, so now they've been asked to distribute the Medicaid money. So once you log in with Optum, there's a few basic authentication steps.
Hey, Suzanne, do you have any idea why it says COVID dental?
You can look at that. That's actually what it says on the screenshot on the next thing. COVID
I know.
dental.
It's like, I have no clue why they picked that. They probably had something up and running and they just used it. Who knows?
You know what?
But you're in the right place.
You'll get the money. You're in the right place. Don't freak out if you say dental, because oral health is very important to us as pediatricians.
There we go. Here we go.
All right, so at the welcome page, the first thing you do is put in your email and click sign up, and you put your email in the yellow box.
And that's why it's important to have one person decide who this is going to be. Because if this person uses the email and goes to another country for a couple of months, which they're probably not going to, nobody else can use this. This has to be someone who's going to be around and not just say, this is too complex. Here, Harry, you do it. It's got to be the same person.
And I would make sure it's someone who's email savvy, someone who never seems to get the emails you send them, who doesn't know how to search their junk or their spam or look at their sent or received emails, is probably not the email address you want to be using. Pick someone who sort of knows how to utilize their email to the fullest. You'll enter your practice TIN and your organization. Most of this is pretty straightforward. Basically, you test, yes, I have the rights to do this. Yes, I promise to be honest and not make up stuff, and just put it in. Then the next step, obviously, is putting in your federal tax classification, depending on how your practice is organized. The common answers are partnership, C corporation, which includes professional corporations, and S corporations. And again, that's very dependent on your state. Exempt pay code, I want to call something out there. This is groups who are exempt from federal withholding. Notice that 5 says a corporation, okay? Now, if you say, oh, my practice is organized as a professional corporation, I should check that. Do not check that box. That a corporation is a typo. It actually got truncated. When you read what the W-9 form says should be in that slot, it's actually things like a corporation which is publicly traded on a major stock exchange, which is not most of our practices, or a foreign financial entity. which is not most of our practices. So do not check that. Just because you happen to be a corporation does not exempt you from withholding.
So follow these instructions and don't just click because it looks good. Actually, for those of us with ADD, read the instructions before you check the box.
Please, yes. Please, yes. This will save you time, because practices who are sort of clicking through this very quickly, because it is straightforward. We all know our TINs and our addresses. Practices who are sort of sliding through this are having trouble getting validated, unless they sort of cross and dot their T's and I's. So you're going to put in your address, and then your servicing location. If you have multiple locations, like you have a Main Street address and an Elm Street address, just pick your main address. And then on the right side, obviously, you're putting in the title and the contact information of whoever the submitter is, in case HHS comes back and has questions. Now, this gets a little tricky. And I think this is why some practices are having trouble. The TIN that you have registered is either a group or an individual registration with PACOS, i.e. Medicare. Well, you say, well, I don't take Medicare. Do you have an NPI? Yes, I hope so. If you have an NPI, then you are registered with PACOS. Okay. Individual, even if you are a solo doc, you might still be a group practice, depending on how you originally got your NPI. And it's been 10 or 15 years.
You can look it up.
You can look it up there at that website. If you're not sure which one is which, just because you've always billed under one or the other, please look it up. And we give some examples of how a group NPI will look different than an individual NPI. So please, if you're a group practice, please put in your group NPI. If you're an individual NPI, you can put in your solo doc, personal NPI, and your date of birth and your license number. You need to re-enter your primary tax ID in the list of all subsidiary TINs, which seems kind of crazy, but that's what they want. And don't put anything in account numbers. That is just going to confuse the system.
Okay, so then you get the green check.
Now, there's three possibilities here. Probably half to 60% of practices who have done this immediately get the green check mark that their TIN has been validated. That's the best case scenario. The second possibility, in maybe 10 or 20% of practices, is it doesn't immediately validate, but if they go and eat lunch and come back in an hour or two, it's validated. The remaining practices, it's taking longer than an hour or two to validate. If you're now, the instructions say allow 48 hours, so 48, and that's 48 business hours to validate. If you still have not received a successful validation or the confirmatory email, which is shown there, in 1 to 2 days, we encourage you to call the helpline, because only they will be able to sort of track the process of your application, and you can see the number there at the top of the screen. Okay, now once you're validated, you'll be emailed a code to view the application, which again looks virtually identical to the application that we showed you how to download and get ahead of time. So you should be able, if you've prepared appropriately, to pull out your paper copy of the application and just put in your numbers quickly. So again, it doesn't save between sittings reliably. Sometimes it does, most of the time it does not. So don't count on that. So let's scroll down.
And this is all done through DocuSign. So the application itself, if you've never played with DocuSign, there are some tutorials that you can even Google and find out, but it's pretty intuitive if you just keep hitting the next arrow.
Right. There's not a whole lot of thinking there, and DocuSign is pretty reliable. So this is what you get back. It's the first, what is that, 7, 8, 9 rows are all filled in for you. You don't have to do anything. You have to start at question 1, contact person name.
And your business name might say 901 Main Street if you got out of sync, but it's okay. It's still you. It's tracked by your tax ID number.
It's tracked by your tax ID. All right. So the first 5 questions are self-explanatory. The first 4 are who's filling out the application. I think you can all do that. The 5th is a 2-letter code which describes your practice. For almost all of y'all listening to this, it's going to be PE for pediatrics. Questions 6 through 9. Only answer these if your practice is a facility. Now, most folks say, well, am I a facility or am I not a facility?
Do you get paid the facility fee when you charge Medicaid patients? That's how you know. If you get paid the facility fee, then you can use this.
Right. So this for almost all pediatric practices, unless you happen to be the pediatric arm of an FQHC or a rural health clinic RHC, this does not apply to you. Enter 000 and blank for questions 6 through 9. And if you do happen to be an RHC, I give you some guidance there. Now, questions 10 through 16. Question 10, you don't have a choice what to enter. You pull out your tax return. Remember how we said you needed your tax return? And you enter in question 10 one of the following depending on what your tax organization structure is, okay? Again, the only exception to what you put in is if you acquired or disposed of other TINs, then you need to complete the gross revenues worksheet, which I'm going to skip for right now because that doesn't apply to most of y'all. Question 11 is the reference here. If you're using your 2018 tax return to put in the answer to question 10, question 11, you put in 2018. Similarly for 2017 or 2019, whatever your most recent filed tax form is. Now, question 12, what percent of your gross revenue is patient care related? Now, most of us are going to say 100. Everything I do is for patient care. Most of it is, but it's not always. And so we sort of run through an example here of Maria's practice. This is Maria's profit and loss, or the profit or the income part of her profit and loss statement for 2018. Let's say her year is. Their total income for the year was about 1.8 million, and most of it came from fee-for-service payments, but some of it came from grants, teaching, research, things that are not
pay for performance and value-based on top of bill above payment, right?
Right. And this is important because, you know, not everything we get is necessarily directly related to patient care. Teaching med students or residents is great, and I'm so glad that so many of y'all do it and you are helping teach the next generation, but that's not in exchange for patient care. Whether you saw 1 patient or 100 patients teaching your students, research, again, even if you're doing medical research, that's not
vaccine research. Those people who are doing vaccine research doesn't count.
That doesn't count in the sense of this.
Yes.
And there's some sort of Q&A guidance. So Maria goes through and she marks red things for not really patient care and green for yes, this is patient care. So yes, count your pay for performance. Yes, count your capitation. So you'll see that Maria's percentage of revenue ascribable to patient care is 98.5%, which is still by and large the vast majority, but not 100% of her practice's revenue for her reference year. So now this product, 98.8.5 times total revenue in this case, the product of question 10 and question 12, this is the money you're going to need to break down by payer in the next section. So remember, when you say, well, what am I trying to break down by how much was Medicaid, how much was commercial, how much was TRICARE, this is the amount that you have to provide sort of an evaluation justification for.
And you may not have all that in OP. So we can help. Suzanne's going to talk about some reports, but if you don't put your capitation checks and your pay for performance checks in OP in some way, you're going to have to do that math yourself. We can't give you a canned report.
Right. And again, this is based on your filed tax return. If you or your accountant or your CFO said your tax income was $2 million, but you can only find 1.2 million in OP, you still have $800,000 in income that you haven't accounted for. But if you didn't enter it in OP, we can't get it out of OP in a report. So again, part of this is OP. OP can help you with that piece, but at the end of the day, your accounting, because this comes back to your taxes, not to your practice management system.
Okay, let's talk about the loss, the revenue lost.
Okay. Now, the HHS has actually been pretty flexible in how they will let you determine this amount. There are a couple of things that are non-negotiable. Lots of people are asking, can I substitute May for March? Because March was pretty much okay, and because of claims lag, my March actually was standard. It wasn't only until April and really May where I started feeling the pain. I get you, but no, you cannot substitute. You have to answer the question how it is asked. You have to say what your reduction in income was for March and for April.
The goal is to give us 2% of our revenue. This question, we think, and we're not sure, is only going to apply if there's extra money to distribute and there may be some additional thing, or for hardships where people say, hey, I lost way more income than I got back that you gave me. But it's not going to be materially impacting that initial distribution. But
that's right.
The other piece of this is, for all of this, please save your work in a folder. If 5 years from now there's a federal government audit, which there often is, you must exactly be able to reproduce the spreadsheet, the screenshots of the report that you did, documented exactly how you did it. So please save all your work in a folder that you can pull out if you need to in the future.
Absolutely. Having survived lots of audits, your auditor is much more likely to take in good faith errors in calculation where you can show how you showed your work, as opposed to numbers that, as far as they know, you sort of pulled out of your butt.
There you go.
You also need to ascribe losses only to COVID. Now, in some ways, you may say, well, my practice only had 2 providers in 2019, and then we had this huge expansion, and we hired 6 more clinicians, and so we actually made more money in 2020 than we did in 2019. Are we screwed? No, you're not, because you might have expected to see 5 times as many patients, but you only saw 3 times as many patients. So there's still a loss you can compute. It's easy if your practice was more or less static to do year over year, compare March 2019 to 2020, but that's not the only way you can do it.
Just make sure you justify exactly how you got that number in a document that you can reproduce.
Right, and enter and if you're entering a loss, which most of us are, it may not be a huge number, but it is a loss, enter it as a negative number. The instructions say to do that, but I think a lot of people are glossing over that. If you enter a positive number, they'll say, oh, you made money during COVID. Yay, go you.
So Suzanne has outlined stuff that must be, that's about your expenses, right? You bought more PPE, it cost you more money. You had to get gowns, you had way more waste because now all of a sudden you're throwing more stuff out. You got your office cleaning people to come daily instead of twice a week.
Lots of ideas here. This is not exhaustive.
You got more iPads, right? Your phone volume went up, office supply. Here's a big one. If you paid for a telemedicine subscription, or you increased your internet access at your office so you could do telehealth, those counts. Teleconferencing subscription, you bought one so your office could do GoToMeeting or Zoom prenatals. All of that counts. If you did any construction, you purchased signs, you put up plexiglass, you bought cones for your parking lot, all counts.
Yep, we bought cones. Question 15 and 16, again, that's basically click and upload these documents we've been talking about. Now, questions 17 through 24 are of the total patient care revenue you had, which is first take your total revenue and then multiply it by the mostly factor. In our example, it was 98.5%. It's probably something in that ballpark for most practices. That product, now you have to say what percent revenue did you get from each type of payer to come up with that product. So let's talk about that. When people ask
This is
me,
not patient panel. This is not what percentage of my active patients are Medicaid. This is the
you
revenue
can't do that.
generated from them. Yes.
You can't, and it's going to look a little askew because all other things being equal, Medicaid patients pay you less than most other payers. That's okay. They get that. This is the amount of revenue generated. So we encourage you to not try to take a shortcut and count visits by payer or patients by payer. Those will not end up giving you correct data. And again, when you have to defend it in an audit, it's going to be really
let's talk about
uncomfortable.
that secondary Medicaid patient, which is where this is really important.
Okay.
Right?
So if you have, and I think probably 8 to 10% of my visits are primary commercial, secondary Medicaid. What you're going to see with these patients is they're going to be almost always ascribed under commercial because you bill commercial first, commercial pays what they're going to pay, and then Medicaid will only pay up to the Medicaid allowable. In most cases, commercial insurance allowable exceeds the Medicaid allowable. So even though these patients had Medicaid at the time you saw them, the dollars you receive for seeing them are going to be heavily, if not entirely, commercial.
Which is why it's revenue. It's income. It's not the patient was ascribed to. Okay.
It's income. Now, don't panic if your total revenue in QuickBooks doesn't match your total revenue in OP based on this method. We've already said there's lots of reasons why they not match. You know, if you have other kinds of income that you haven't been logging in OP, but you have been faithfully, as you should be, logging in your accounting software, there's always going to be a little bit of lag. But unless you are making the argument that the end of year slow payers are always one payer or another, it's really not going to matter. We're talking about like 2% or less. But what you can go through, if you go to the next screen, is basically here's your money. We sort of talked about other forms of income and income that's not logged in QuickBooks, which is or income that's logged in QuickBooks but not in OP. If you scroll down, you can see the adjustments that you make. You're going to add back your P4P money by payer here. Classifying payers, again, you can read these fine print definitions. They probably won't surprise you hugely. The big thing here is CHIP counts as Medicaid. Even though it's not Medicaid, it counts as Medicaid, not other governmental plans. CHIP does not go in other governmental plans. There's a list of things that do, though. So I like the color coding because I think it really jumps out at you. So green is Medicaid and CHIP. Blue is commercial. Other government is that sort of light gray color. And then other stuff is yellow. Newborn pending. You're going to have to go and find whether those were Medicaid newborns or commercial newborns or CHIP newborns or TRICARE newborns or what. $38 unascribed, just call that other. And then $1,000 of other, you're going to just have to say that's unknown and call it other. You can do a pivot table. The reference to that is at the beginning of this document. To find totals by type, then you get your percents by type and you plug and chug. Questions 25 and 26 are basically entering your SBA and FEMA support if it applies. Now, here are how you have to classify your employees. You start by making a list of your employees. There you go. Name, what their job is, and how many hours a week they work. Now, the good news here is that HHS has allowed you to define what FTE is. If that's 40 hours a week, then you call, then you make that call. If it's 36 hours, 30 hours, whatever it is, you determine what FTE these folks look like. There is no standard. What another practice uses may or may not be your practice's definition. You pick your definition and you stick with it. So there in the fourth column, you see the FTE of each of these folks. Now, you have to subtotal the FTEs into three groups. Independent clinician, which is a physician, or if you have them, dentist, or a nurse practitioner, PA, or midwife who is not supervised by a physician. We're going to come back to that in a minute. The second group is all other clinical staff members, which is medical assistants, LPNs, RNs, dietitians, audiologists, therapists, psychologists, and then the third category is everyone else who works for your practices, which would be administrative assistants, receptionists, billing staff, and so on. Now,
because Suzanne likes color coding.
I do love color coding. I think it's so easy to see. Now, whether your advanced practice clinicians, your nurse practitioners and PAs are peach or blue depends on the state you're in, okay? For example, I'm in Tennessee. We have 3 nurse practitioners. Tennessee does not allow nurse practitioners to practice without a supervising relationship. Now, I don't go in and I don't joggle their elbow every time they see an eczema or an otitis because they're too good for that. But
they couldn't set up shop.
Law,
they couldn't set up shop across the street.
They can't set up shop independently. No, that is a state law.
And it doesn't have anything to do with whether you co-sign a percentage or whatever.
No,
it's whether it's the scope of licensure based on state law.
Yes, and so that's, if you don't know, you need to call your state medical board and find out. The other adjustment you need to make is people who are owners and do not get a W-2 need to be excluded from this list. Now, some owners still get W-2s if you're organized as a corporation. So you can look back at 2019 and see who you sent what forms for. If you have physician owners who are shareholder owners and they received a W-2, then yes, include them in the peach.
And and many of them will have like my practice, we have a W-2 and a K-1 profit distribution, but you at least need part of your income to come from a W-2.
From a W-2, even if it's just $1, right? Now, my practice, we have 2 physicians who are employees and 2 physicians who get K-1 partnership income only, okay? They would not appear on this list at all because they are not W-2 employees. Obviously, now the other thing is if you have contract workers, like you have a temp coming in from to staff your front desk 2 days a week or whatever because of COVID, then you would not include that person here either in your FTEs. So then based on who's left, you enter each of those FTE subtotals in questions 27, 28, and 29. Question 30, number of office locations, easy peasy. Question 31, you need to fill out this form only with the peach people. Okay, so that's your independent clinicians, and this, again, this is independent according to state law, not according to your custom and practice, and their FTEs and their NPIs.
And now, this was people who were employed as of what date, Suzanne?
5/31/20.
Got it. So people you laid off and didn't bring back yet don't count.
That's correct. That's correct.
People you hired and started June 1st don't count.
They don't count. And then question 32, you're uploading your 941 form, again, to substantiate sort of these numbers here. And then the last 4 questions are basically how you want to be paid, which is your bank ABA routing transaction information. We finally go through a few Q&As at the end. Some of it we've already talked about. Here under how much money I get sort of reiterates what Sue said earlier. HHS is going to send you the lesser of 2% of your gross revenues for your reference year or your total losses. in almost every case, and OP has actually run this data, it's probably upwards of 85, it's probably 95%. 2% is less than what you actually suffered. Because honestly, if all we suffered was 2% loss, would any of us be having these conversations? No, we suffered a lot more than that. So you're getting 2%. So don't kill yourself trying to capture every last lost dollar. 2% it's not going to get you more money absent extraordinary circumstances.
Right.
And this example sort of goes through that.
Okay. We have until July 20th. We don't know if it's 6 a.m. or 6 p.m. So be on the safe side and do it by July 19th.
You have a full month.
This is not first come, first serve. This is they actually did the math, and that's where they came up with this 2% and decided how to divide it up among people. So there will be money, but I wouldn't be the first to play, and I wouldn't be the last. So you don't have to apply, but if there's leftover money, they may find a way to reward those Medicaid top heavy practices, or they may go to rural hospitals or hospitals that do a lot of Medicaid patients. We have no idea.
If you don't line up, you won't get anything.
Yep. This does not need to be repaid. This is money. It is taxable, however.
Mm-hmm.
Great. This is the information we have as of 6/15/20 at 10:09 p.m. Eastern Time. We expect to get more information as this goes forward, but please listen to this whole thing and read the information first. The Academy, the AAP, has frequently asked questions. They're already on the Help Center. Suzanne, I can't thank you enough for the countless hours you've put in over the last couple of days trying to prepare this for pediatricians so we can get some relief. We appreciate all of the people who've helped us pull this all together. You can tell by now this is not terribly complex, but you must do the homework. Save your work, document everything you do, stick it in a folder somewhere that people can access if you ever get audited, but go get the money you deserve. We see patients, we do hard work, and most importantly, please stay safe, take care of yourselves, your family, your practice, and your community. You matter greatly for all the work that you're doing in your communities during these trying times. Thanks, Suzanne.
Thank you.